In this video, we'll discuss about calcium sources, RDA functions, regulations, and disorders. So, first one is introduction. Total body calcium is 1 to 1.5 kg. Of this total body content, 99% found in bone and teeth. Remaining 1% found in extracellular fluid, which is important for number of functions in our body. So total body calcium 1 to 1.5 kg. Of this 99% found in bone and teeth, 1% presented in extracellular fluid, which is important for number of functions in our body. Coming to sources, there is calcium predominantly presented in milk and milk product, also presented in meat, egg, fish, vegetables, cereals and pulses. It recommended dietary or daily allowance for adult 800 mg, children 800 to 1200. In the period of pregnancy, lactation and menopause period, it requirement of calcium increases. It is up to 1.5 gram. So this is RDA of calcium. Now coming to biochemical functions. Biochemical functions of calcium. First one is it is used in development of bone and teeth. Calcium along with phosphate, it is required for formation of hydroxyapatite. It helps in the mineralization of bone. So first one is development of bone and teeth. Calcium along with phosphate required for formation of hydroxyapatite. It is help for mineralization of bone. Second important functions, muscle contraction. It increases this action of actin and myosin. It facilitate or required for excitation, contraction and coupling reactions. So second one is muscle contraction. Here it increases the action of actin and myosin. Then it facilitate or required for excitation, contraction and coupling reaction. Third, biochemical functions. Blood coagulation factor 4. This calcium positively charged. It bind with negatively charged prothrombin because of gamma carboxylations. Calcium bind with prothrombin, it will converted into thrombin. This one help for coagulation reaction. Then fourth functions, it is important in nerve impulse transmission. Fourth function important in nerve impulse transmission. Next one is fifth one. It is responsible for membrane integrity and permeability. Also responsible for transport of different ions across that cell membrane. Responsible for permeability. So fifth functions, responsible for membrane integrity and permeability, also responsible for transport of different ions across that membrane, responsible for permeability. Sixth one, it is responsible for actions of certain enzyme. It include ATPase, include calcium, magnesium, ATPase, then adenylate cyclase, pyruvate kinase, pyruvate dehydrogenase, then pyruvate carboxylase, then glycogen synthetase. It is responsible for actions of certain enzyme. Seventh one, calmodulin. calcium binding with protein, it involved in various physiological processes. Then eighth function, hormonal action. Calcium responsible for releasing certain hormones. Examples, insulin, vasopressin, parathyroid hormone, etc. Then ninth one is secondary messenger. Calcium is a secondary messenger in the hormonal action. It involved in inositol triphosphate diacetylglycerol pathway. Example, glucagon. Calcium is secondary messenger for glucagon. Then secretory action. It involved in secretory process, endocytosis, exocytosis, etc. So these are the various biochemical function: development of bone and teeth, muscle contraction, then blood coagulation factors, the nerve impulse transmission, membrane integrity and permeability, actions of certain enzyme, calmodulin, hormonal action, secondary messenger, secretory process. Calcium has action on heart. Calcium prolonged systole. These are the different functions of calcium. Next, regulation of calcium level in our body by 3 hormones. Coming to regulation of calcium level in our body, it is mainly by 3 hormones: parathyroid hormone, vitamin D and calcitonin. Normal serum calcium level 9 to 11 mg per deciliter. So calcium is homeostasis. It is maintained with the help of 3 hormones. This hormone is homeostasis, so maintained with the help of 3 hormones. Normal serum calcium level 9 to 11 microgram per deciliter. Of this blood calcium, 50% of calcium it is ionized form, 40% found to that protein, remaining 10% it is associated with bicarbonate, phosphate, etc. Now calcium homeostasis maintained with 3 hormones. So first one is parathyroid hormone. It is responsible for demineralization and decalcification. It is responsible for increase in serum calcium level. It increases that vitamin D, so directly it increases the intestinal absorptions of calcium, increasing reabsorption of calcium from renal tubules. Then second, vitamin D increases the absorptions of calcium from intestine. This is through calbidin protein. Vitamin D is important for bone mineralization. It increases the reabsorption of calcium along with the phosphorus from renal tubules. Then third one is calcitonin. Third hormone, calcitonin, it is responsible for decreases calcium level. It acts opposite to parathyroid hormone. It is important in mineralization of bone, and it decreases reabsorption of calcium and decreases intestinal absorption of calcium level. So in this way, vitamin D, parathyroid hormone, calcitonin regulate that calcium level in blood. Now coming to absorptions of calcium, it is against the concentration gradient with the utilization of energy. from first and second part of duodenum. Absorption increases by vitamin D, parathyroid hormone, lysine, arginine, low pH, lactose. Absorption decreases by phytate, oxalate, phosphate, high pH, dietary fiber, free fatty acid. So, absorption increased by vitamin D, parathyroid hormone, lysine, arginine, low pH. Decreases by phytate, oxalate, phosphate, high pH, dietary fiber, free fatty acid. Next, clinical significance. Serum calcium is distributed by two methods. One is Arsenazo method, second one is OCPC method. These two methods commonly used to estimate serum calcium level. In the clinical significance, there are two conditions. The decreases serum calcium, that is known as hypocalcemia. Normal range 9 to 11 mg per deciliter. Increases serum calcium level is known as hypercalcemia. Hypocalcemia, hypercalcemia. Symptoms of this hypocalcemia: convulsions, arrhythmia, tetany, spasm. Decreases calcium level causes include rickets, osteomalacia, osteoporosis, decreased parathyroid hormone activity, medullary carcinoma of thyroid. In this condition, there is decreases in serum calcium level. Serum calcium level less than 7 mg per deciliter means medical emergency condition. It is also known as tetany. Treatment: injection calcium gluconate 10%, 10 ml, 10 minutes. Then maintenance of trips. This is treatment of tetany. Then hypercalcemia condition, more than 11 mg per deciliter. This one causes include parathyroid hormone, tumor, secondary metastasis in bone, bone tumor, multiple myeloma, Paget disease of bone. So this condition increases serum calcium level. So these are the condition serum level increases. This one is the biochemical functions. Thanks for watching.